Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Birth control is a contraceptive. It's any method to prevent pregnancy, and the only way to ensure you don't get pregnant is to abstain from sex completely. Now, birth control can help you also avoid an unplanned pregnancy. There are plenty of different kinds, and you may not know that birth control is also used to help with young girls or women who have heavy bleeding during periods or cramps. Express Care's Dr. Jitka Lom joins us now to talk more about this topic. Thanks for coming in, Doc. Sure. Tell us about the different kinds of birth control and why, I guess, or what the different types are and how they're used or administered.
Sure. So, you know, as far as birth control, we have the barrier methods, that's like condoms or sponges and that kind of thing, or then hormonal methods of birth control, and the most commonly known is the birth control pill or the Depo-Provera shot. And then we have implantable devices as well, like IUDs, that's called intrauterine device, either a little piece of copper or a piece of plastic with some hormone inside that is placed inside the uterus. And then finally you have some other implantable devices like basically hormones that are implanted for quite some time in the arm.
So there's so many of them, so it's a wide array. So how does a woman know, how does a woman pick which is right for her?
Well, unless you have your sterilization procedure, meaning tubal ligation, then birth control choices are individual and not permanent. So you can choose based on your life circumstances. If it's incredibly important that you don't get pregnant, then it's most important to choose a method that is very effective. Some methods are more effective than others. For example, condoms by themselves have about a 15% failure rate. So that's, you know, pretty significant. Whereas if you take birth control pills, then they're about 95% effective if you take them properly. And if you use a Depo-Provera shot, it's about 1 in 1,000 women that will get pregnant. So that's it, one decision point. And another one would be side effects and also ease of administration. If you're not good at remembering to take pills, then maybe a shot is better for you, or an IUD. Looking at some of the side effects also, sometimes birth control pills can have some side effects that women don't like, and they may choose to have a non-hormonal birth control instead.
Now, as I mentioned in the intro, that birth control isn't just used to prevent pregnancies, but it can also have good effects on helping women who are bleeding a lot and having cramping during their menstrual cycles.
That's true. As far as the contraceptive pills, they're very helpful at lightening up periods for most women and reducing the pain that comes along with periods, and that can sometimes make girls miss school or whatever, miss work for women. So it's important to know that, and you can try it. Usually after a period of about 3 months, you'll know whether it's effective for you.
Okay. Now, as I was doing some research, what is progestin and what is estrogen? And I know some birth control has one or the other, so how do you know what's good?
Right. So as far as hormonal methods, the birth control pills can be combination pills. That means they have 2 kinds of hormone, the estrogen and the progesterone component, or they can just be only progesterone, and that would be both for pills or, for example, the Depo-Provera shot. And what's the difference? The difference is basically the side effects that you will receive from that. If a woman is breastfeeding or after pregnancy, then she would probably choose a progestin-only birth control method because it wouldn't affect the baby as much, and it would make her breast milk safe for the baby, for example. So these are kind of the differences that you would discuss with your doctor to pick the best one for you.
Now, you were mentioning some side effects, you know, and I know just in talking to friends and things who've been on birth control that some make you gain weight, some have other side effects. So let's talk a little bit about some of the side effects that women might have with birth control.
Sure. So with the birth control pill, weight gain is a concern for many women. It depends on the body type. If somebody is already prone to gaining weight, then yes, the pill could make them gain weight. The average, though, would be somewhere between 5 and 10 pounds that they could blame on the pill. Yeah, the rest would be their own. But as far as Depo shot, sometimes it will make people gain a little bit more than that, even maybe 10 or 15 pounds even. So that's a consideration. Knowing that that's a side effect, when you start on the birth control pill, you can really adjust your diet and increase your exercise, and that'll offset it.
Okay. Now, why is smoking always a warning? You know, when you see it on TV, the commercials for different kind of birth controls,
Yeah.
one of the ones that you almost always hear is that you shouldn't smoke while taking birth control.
That's
Why
true.
is that?
Well, you shouldn't smoke, period.
Right.
but, but as far as the birth control pills, when you are smoking and it's in combination with the estrogen component, it makes your blood stickier and you'll be more prone to getting blood clots, especially in the legs, and then a little bit higher risk of heart attack and stroke as well. So to minimize your risk of those really serious side effects that we didn't really touch on, but they're there, you know, it's very tragic when a young woman taking birth control gets a stroke, you know. Another thing that birth control pills can do is raise your high blood pressure. So that's something for those women who have that problem to be aware of.
Now, what do women do if they've been on birth control but they want to conceive and they're thinking, okay, you know, maybe in the next year or so I'm looking at, I want to have a baby. So how do they kind of transition from that, knowing when to stop? Because I'm sure when you get off right away, you're not necessarily going to get pregnant right away.
That's true. And that's the whole purpose of family planning, is to plan your family beautifully so that it's the best, you know, outcome. But as far as the washout period is really what you're talking about. For the birth control pills, it's just 1 or 2 months. You'll be back to your normal fertility usually. With the depot shot, though, it can take 6 months or even longer before that has worn off. And then as far as the IUD, those ones are pretty much effective, or if you remove them, then pretty much within a month the woman will be back to normal again.
Okay. Any other things you want to leave before we throw a break? Any other?
Just about birth control, that, you know, on Guam we have a huge problem with teen pregnancy, and I think it's important to discuss with our young women about birth control prior to their becoming sexually active, and to face reality, to know that it's going to be better for them to just be on something and prevent at least an unwanted pregnancy.
Okay.
Yeah.
All right. Well, we will pick up our discussion on birth control after this timeout.